My name is Barrett Labram. I am a physician at Primary Care Pediatrics. I've been practicing for 8 years now, 5 years out of residency, and I've practiced the whole time here at Primary Care Pediatrics. We're here to talk a little bit about fevers. It's one of the more common questions we get. I want to start with an introduction about what exactly is a fever. A fever is actually a sign of some kind of infection. Oftentimes we think that fever itself can be dangerous, even though it's not. All it is a sign that there's some kind of either viral or bacterial infection going on. Honestly, most of the time when someone has a fever, it's usually a viral infection. But a fever can also be a sign that something more serious is going on, like some kind of bacterial infection. Oftentimes we feel like if a kid has a fever and they're super sick, we always think about meningitis or something really bad like that, and it can be true, but it's not always related to that. One thing about a fever that we always have to remember is it's really the best way to take a temperature is with a thermometer. Oftentimes we get parents to come in here and they think that, oh, my kid had a fever and it was, we didn't really take it, but he was super hot. Even though that can be relatively accurate, it's best to give us as much information as possible, and taking a temperature with an actual thermometer is oftentimes helpful in helping us make a diagnosis. Another question we oftentimes get is, when is it absolutely necessary to come to see a doctor? There is no absolute number or rule. There are some general guidelines. A temperature of 104.0 or above indicates you probably should be seen by a doctor. A temperature of a fever, 100.4 or above, that lasts for more than 3 or 4 days should be seen by a doctor. Any fever that lasts for longer than 24 hours, that despite having medication doesn't get any better, should be seen by a doctor as well. Sometimes there are complications of fevers. I want to make sure that we understand that these are rare complications. Most of the time fevers are fairly benign. One of the first ones that are a little bit more common that we see with fevers is dehydration. Dehydration is caused when someone has a fever and they might be vomiting or having some diarrhea. The fever will increase their chance of having some kind of dehydration. And so it's important that if you have a fever and they have those other symptoms, that we watch them for signs of dehydration, such as not drinking very well, maybe not going to the bathroom as often as usual. Another question that we oftentimes get is, how do I treat a fever, or do I need to treat a fever? You do not actually need to treat a fever. A fever is your body's natural response to some kind of infection, and a fever can actually be helpful in trying to treat that infection. A fever does cause you to have body aches, muscle pain, just not feeling good in general, and so treating a fever is also a fair option. A fever is treated by using some kind of antipyretic medications, typically Tylenol or ibuprofen. Tylenol is used in kids that are under the age of 6 months of age. Over the age of 6 months, you can use either Tylenol or ibuprofen. I know I didn't cover everything there is to know about a fever. Fevers are very complicated and they can be scary. There's a lot of nuances related to fevers that there's no way we could cover everything now. The bottom line is, if you're concerned about your child and they have a fever, we would rather you call our clinic and talk to one of us, or talk to our resource nurse, and we'll try and answer any questions you might have. If you're concerned, bring them into clinic. We're more than happy to see them as well.